Hi, I'm Marty Nemko. This is the latest in the Tough Problems series. In each installment, I present two composite questions that my clients face and my response to each. I want you to know, because these questions relate to health, I want to make clear that while I do teach medical students at the University of California, San Francisco, I am not an MD. I have a PhD in educational psychology, and I'm a career and personal coach. What I'm providing here is for information only, largely my personal viewpoints. In the case of coronavirus, it's how I'm implementing the advice from the CDC and UCSF. And in the case of reducing risk of cancer, I'm citing mainstream advice, plus how I deal with health fears psychologically. First letter goes as follows. Dear Dr. Nemko, I'm freaking out. The coronavirus is spreading and is more deadly than the flu. I live in the San Francisco Bay Area, one of the U.S.'s COVID-19's hotspots. I'm washing my hands a lot, but I'm still freaked out. Any thoughts? Here's my response. The media's coverage makes it easy to freak out. Perhaps you'll find it helpful to know how I, who also live in the Bay Area, deal with it. Candidly, even though it may not be helpful, I can't help but frequently Googling coronavirus Bay Area. But I force myself to focus only on the helpful and the positive. For example, that if you take reasonable precautions, which I'll mention in a moment, your risk of serious disease and especially death is quite low. I reinforce that psychological balm with good hand hygiene. After contact with public surfaces such as restaurant tables, public bathrooms, or my UCSF classroom, I wash my hands vigorously with soap for 20 seconds. The reason for the vigor is that it mechanically destroys spores. If you don't have a good sense of what 20 seconds is, sing the happy birthday song. You know, happy birthday to you, you belong in a zoo. Do that twice, and that's about 20 seconds. Speaking of UCSF, it may be reassuring to know that it, which is among the world's leading medical centers, is closely monitoring the coronavirus situation. And just yesterday, they emailed us to say that our classes are not being canceled. They're going to be continuing as usual. Also, I have temporarily, one other precaution I'm taking is that I've temporarily suspended shaking hands or hugging people, except my wife. So, even though the San Francisco Bay Area is one of the U.S.'s hotspots, I perceive my risk as quite low, so much so that I plan to attend a high school performance of West Side Story in which hundreds of people are going to be in the audience. Yeah, I plan to not touch my face that afternoon until after I've washed my hands. In short, my suggestions, consistent with the CDC's, are wash your hands thoroughly, especially after contacting surfaces that are touched by many other people. Especially if someone's coughing or sneezing, keep 6 feet away, 2 meters. If you need to cough or sneeze, do it in your elbow or into a tissue you throw away. If you're sick, stay home and follow the CDC guidelines. Just Google CDC coronavirus guidance or advice or whatever, you'll find it. And then just live your life. A silver lining in the fear of illness is that it reminds us that tomorrow is promised to no one. So at the risk of cliche, try to make the most of each day, whether it's to be maximally productive, playful, or strive for work-life balance. The second letter goes like this. Dear Dr. Nemko, I'm not scared of death. After all, I wasn't aware of the time before I was born, and I'm not going to be aware after I die. But I'm scared of the dying process, cancer specifically. How can I deal with that? Here's my response. First, you can reduce your cancer risk, for example, by controlling your weight, eating lots of fruits and vegetables and small amounts of the rest, and of course by not smoking or abusing substances. Then, even if the worst case hits, you develop end-stage cancer, in increasing numbers of states, you can get assisted death, informally called death with dignity. You also boost your chances of, as they say, dying well, by including an advanced medical directive as an addendum to your will or trust. In that, you specify that if you're incapacitated and unable to make healthcare decisions for yourself, you wish to not have your life extended artificially when your quality of life is irreversibly very bad. Maybe you'll decide that's if you're in severe and uncontrollable and irreversible pain. You may or may not wish to have an attorney drafted for you, but in any case, it certainly can't hurt to look at AARP's Model Advanced Directive Forms. You just Google that, AARP's Model Advanced Directive Forms, and you'll find it. AARP offers a model form for each state. Append a copy to your will or trust, and provide a copy to your healthcare provider as well as to the person or persons you designate to make healthcare decisions for you in case of incapacity. Having done those things, maybe most important, as soon as you start having an unhelpful fear, distract yourself to something constructive. That way, you can make the most of the good times. In any event, I thank you for watching. I'm Marty Nemko, I welcome your thumbs up and accept your thumbs down. I always look forward to your comments. I love it when you hit the share button below and share on your social media so my efforts have broader impact. And I'm flattered if you choose to subscribe to my channel. In any event, I do thank you for watching. I am Marty Nemko.